not speaking, please sign in the chat room with your name and region, as well as any questions, and we'll try to monitor that for you. We'd like you to know that this session is being recorded, and turn off your video if you don't want to be on camera. And without further ado, here's Jorge and Monica.
Muchas gracias, Jonathan. Thank you very much, Jonathan and Luis. It's a pleasure and an honor to be here. Hello, everyone. Thanks for joining us here. So my name is Jorge Martinez. I'm with Oregon Health Authority, the Community Partner Outreach Program at the Oregon Health Authority, and we're going to be sharing some COVID-19 resources with you all. I'm here together with my colleague, Monica Juarez. Monica, do you want to introduce yourself?
Yes, good afternoon, everyone. So Monica Juarez, work with the Community Partner Outreach Program, as well as Jorge mentioned, and here to present with you just information we have our program and ways to collaborate and work together to serve our immigrant communities. Thank you.
Yeah, thanks, Monica. And so our agenda for today, we have some, first of all, we're going to talk about a little background stuff. We're going to talk about the CPOP program and what we do, and then the Protecting Oregon Farm Workers program as well. And then we'll get into a little bit of the impact, what's going on with currently with COVID-19, and Monica's going to get into vaccine resources and additional resources. So that's our agenda. But to start off with, we just wanted to share really briefly some background information about who we are. And so the Community Partner Outreach Program, or CPOP, is part of OHA. It sits within the External Relations Unit, and we deal with community partners. We provide training and ongoing technical support to these partners that assist individuals with OHP applications, primarily since the COVID pandemic began. We've also been involved in the state's response to COVID-19. So, but we have a huge network of partners. We work with about 300 community-based organizations around the state, and this is about 1,400 individual OHP assisters. These are approximations. They're not exact figures, but it's just they're approximate numbers. So this is how we are divided around the state. We're a team of about 25 or so. I forget the exact figure, but we are a pretty large team. We're managed by Oliver Vera. He's worked extensively with Jonathan and the Oregon Department of Education, and great boss to work for. Monica and myself started out as ROCS, Regional Outreach Coordinators, and you can see all of them here. And now we've been transitioned to more of a statewide role. But we do have statewide positions too. You can see them all here. Those are our contact information. And these are the regions around the state that we serve. You can see it's divided up by region. So yes, feel free to reach out to us. We're a big team, and that's kind of the background of who we are. Now, more specifically about working with the migrant seasonal farm worker community. Back when the pandemic started, we got involved with the response, the COVID-19 response, and we actually worked with Jonathan on developing strategies and tactics and best practices on how to reach out to this community. Jonathan participated and myself and a bunch of other people from all the agencies. It was an interagency effort essentially, but we all contributed to providing best practices on how to reach the migrant seasonal farm worker community. And so as a result of this, the Food Security and Farm Worker Safety Program was developed, and it was an effort by the state to protect farm workers. Essentially, they provided all those services to farmers, directly to the farm workers themselves. There was a lot of money that was given out to the community, and the Community Partner Outreach Program received $3 million of that to develop the Protecting Oregon Farm Workers program specifically to do outreach and education. So this became the state's formal response, COVID-19 response to POF. And, you know, I'm happy to say that Jonathan contributed to that, to developing that. And, you know, yeah, I mean, so big thanks to Jonathan for helping us, like, you know, get this far. If it wasn't for that collaborative effort, interagency effort, we really would not have what we have today, the program that we have today. So it was great to have to work with him and collaborate. So in any case, we started with 16 original partners around the state in key areas, in areas that Migrant Ed has a presence in. And we started off with those 16 partners. Now we have 22 partners throughout the state in key areas, you know, the Interstate 84 corridor, the I-5 corridor, you know, all of the places we know where farm workers are at. We have partners in those areas. And so the partners help us do outreach and education specifically related to COVID-19. They do face-to-face outreach. They do all social media outreach, other traditional media outreach, all kinds of different outreach that our partners do specifically for MSFW community. They also do PPE distribution, you know, masks, hand sanitizers, coverall, face shields, whatever have you, whatever is available, they help us distribute it to the community. But they also do, we also do like air purifiers or water bottles for staying hydrated out in the field, a lot of different stuff that we've been engaged in. The partners also do RAP service navigation, so anything related to wage loss, you know, they help people impacted by COVID-19 access those resources, those RAP resources that people need, you know, wage loss, housing, utilities, any financial supports that might be available, or food, even food, accessing food. That's what our partners help folks do. And then they also do testing and vaccine registration and navigation, and they even stand up vaccine clinics on their own with the help of OHA. All of this to say that those partners are available to collaborate and assist with you. They're spread out throughout the state. They're more than likely, you might already be working with them. You might already have relationships with them, but they are there to serve you, to help you, and they can plug you into any resources your families might need. So please consider reaching out to them. And these are the regions that we have. I won't go into all of the specific organizations, but you can see we have a strong presence in all the major regions of the state, you know, Southern Oregon, the Coast, Valley, the PDX Metro, Gorge, Central Oregon, and Eastern Oregon. So yeah, these might look familiar to you all. You know, we even have a partnership with OCDC in the Gorge, you know, the sister organization of Migrant Ed in Central Oregon and the Gorge. So, and we have a document that I've shared with Luis. He might be sharing it with you all, but it's the specific contact information for these partners. And so you'll have that available to you. We've provided a contact person and then their contact information. So you'll have that as well. But in any case, moving on from that, these partners are available to assist you. We encourage everyone to reach out to them, either if you're a community member or you work for the MEP program or whatever it may be. Please use these organizations as a resource for you. And so there's some of the stuff that our partners have done. Here's we purchased 3,000 air purifier units. These were pretty, you know, sizable air purifier units that you can have in your sleeping quarters or in your home, whatever have you. And we partnered with OCDC, OHDC, the Oregon Employment Department to distribute these out to the community. OCDC was actually very critical in this effort, and OHDC as well, but they helped us get these out to their families that they serve in Malheur and I believe Klamath County and even Central Oregon. But there were various offices, OCDC offices that received these, and so yeah, that's one of the efforts that our partners have helped us with. The POF is engaged in helping protect Oregon's farm workers. Here is a vaccine clinic, a picture of a vaccine clinic that we did out in the Hermiston area at a Guatemalan church. Our partner Uvalkyrie helped us set this up, vaccinated about 35 people. So it was a great event. This is a great example, and they're doing this all throughout the state, right, in different capacities with different results, all throughout the state. So our partners are engaged in that great work. Shifting gears a little bit, just want to really quickly talk about the Epi curve. I'm not sure if you guys have heard of what the Epi curve is, but essentially it's the epidemiological curve, right? It's all the numbers of cases that we've had since the pandemic started. So they charted all of this, right? And so we have the total cases as of earlier this week are 367,000. You can see the hospitalizations, not hospitalized, et cetera. I'm pointing this out because I want to emphasize that we are on a downward trend in COVID currently right now. You can see that it kind of peaked at the beginning of September, and we've started to go down, and it is trending downward, but we are not. The doctors, the state senior health advisors that advise us on what's going on with the pandemic have told us we are on a downward trend, but we're not out of the woods yet. So I say all of this to emphasize that yes, we are on a downward trend. The cases are decreasing. However, we are not out of the woods yet. This pandemic is far from over. We don't know what could happen from one day to the next. So I really want to emphasize that. But you can see, I mean, essentially, we've been up and down all over the place, peaked in, end of August, beginning of September, and now we're trending down. So that's what's going overall, kind of an overall picture of what's going on with pandemic. These are hospitalizations and ICU visits and people that are on ventilators. So these are the hospitalizations, these are the ICU folks, and then these are folks that are on ventilators. So you can see it follows the same curve that we just looked at. It's the hospital visits are on the decrease as well, and it just matches the Epi curve. But again, I share all this information to let you know that we are on a downward trend, but the pandemic is still there. People are still being hospitalized because of this disease. Okay, shifting gears a little bit, just want to talk a little bit about the statistics of we know that our Latino community has been disproportionately impacted because of the pandemic. Throughout the entire pandemic, we have been one of the communities that has been the hardest hit because of the pandemic. All people of color, but especially our community has been hit pretty hard. So, of those 364,000 cases throughout the state, we know that 17% of them are of Latino origin, and if you look at our population in the state, it's about a 12%. So that's a disproportionate impact in our community. We account for more than we should account for, essentially, is what this is saying. And so 11%, approximately 11% of Latinos have tested positive. Of the entire Latino population in the state of Oregon, which is about 500,000 or so, 11% of those people have tested positive for COVID. By comparison, for non-Latinos, you have about 8%. So you can see the disparity there, right? You can see that our community, and this is common knowledge. I'm sure that most of you have already heard this information, but it's important to see the figures, the exact figures, and you can see that there are disparities there. Something really appalling to me is that for every 100,000 Latino people, 11,000 have been infected with COVID. And by comparison, you look at the non-Latino community, and there's, around 5,000. So I was sharing all of this just so we get an understanding of what the numbers are, the disproportionate impact of COVID in our community. We've been hit harder, and OHA is taking the steps to, we've been trying and it's important to keep trying, right? But in any case, that's kind of where we are with that. Okay, I will be quiet now. Thank you very much. That's the end of my portion of the presentation. I'll turn it over to my wonderful colleague, Monica Juarez. Monica.
Thank you, Jorge, and good afternoon, everyone. So Monica from OHA, for those who just joined us a little bit later. So just wanted to share also just what Jorge was mentioning is, so vaccines, as you know, they're free and available, and they should be available to most of our immigrant community or farm workers. And this is regardless of their immigration status, insurance status, or any other factor. So for those who have the Oregon Health Plan, obviously they do qualify. And for COWIM, so COWIM is a portion of the Oregon Health Plan that is available to those, the immigrant community who are undocumented, adults over 19, where qualifies only the emergency services. So with this coverage, yes, it is the emergency, but also covers most of the COVID treatment and, like I said, vaccine or any other relevant anything with COVID related. So the vaccines are administered at any medical facilities, and they're proven to be effective. And as Jorge said, our communities definitely are being with this infection has hit our community in many ways. And so we're trying to just spread the word, let people know that we need to get vaccinated. And that includes, there's multiple locations, like I said, federal qualified health centers, which is most of the county clinics, pharmacies. And we've been providing a lot of information and vaccine events, different community events. And so there's even an opportunity for many of you in this group that if you're interested in hosting or help in an event that you already gather families, talk to us, and we'll and how to accomplish that. And we'll give you more information just in a bit. Next, Jorge. So as Jorge mentioned, there is, kind of give you a little more breakdown of the vaccination rates. So as you can see, compared to the infections, it kind of follows the same pattern in vaccination, unfortunately. So if you see like the people who have taken the first dose, just the one vaccine, when you compare to like the community, that white population, for example, is 71%. And then when you, look at the Latino, is about 56%. And then for those who completed the whole series, which is the two doses, is we're looking at the difference as well, which is in this case 50% for the Latino. And then I will tell you more information in a little bit, but also for those who have already qualified for the booster, as you can see, that's currently happening, but we're still a very low percent, like 2%. And essentially, all of us should be getting the booster. And I will tell you more info in just a bit. And here's what I was referring to, who is eligible for the third dose or the booster. So let me first tell you the difference between both of them. So who qualifies for the third dose? So if anyone, let's say, received Moderna or Pfizer, which are the vaccines who you technically need 2 doses, you should be good with those 2 as long as you meet the 28 days from first to the second dose. Now, who qualifies for the third dose are for those people who have immunocompromised, for example, if they're under cancer treatment, if they have any transplant, or anything where their immune system will require a third dose, and that's 28 days after their second dose. And most of people in this group, they're going to be notified from their providers. So the providers should reach out to them and to let them know that they need their third dose. And if you're in any of those groups, you can also connect with your provider and to let them know, and they should be able to help get you the third dose. Now, if we look at the booster, which many of us, this is the category where many of us will qualify, and we should qualify 6 months after we got our second dose. So if you got yours in about March, we should be in November. So you should be able to get your second, sorry, not your second, your booster. And that's for people who are 65 and older, 18 years and older, who have underlying conditions, but also most people who qualify in congregated places like schools, like if you're a teacher, if you work with students, if you are a Margaret and Sister farm worker, you work in food processing places, grocery stores, anywhere where you're interacting with people consistently, and you should definitely connect and get your booster, which is, like I said, many of us will be in that category. Go next. Okay, so now let's talk about the pediatric vaccine, which is pretty recent, pretty new information, and very relevant to many of people in this group. So the CDC and also the Safety Review Group had approved a Pfizer and for children between the ages 5 and 11. And as of right now, we are making the vaccine widely available. So it should be distributed, and actually it's being distributed currently at many of the clinical facilities, different counties, and should be arriving, if not now, should be there in the next few days. So should be starting maybe next week, early next week. They should be available for different clinics to, schedule appointments and making sure that kids in this age group get their vaccine. So we go next. So like I mentioned, many of these places we talking about federal qualified centers, county health departments, pharmacies, public health clinics. And we also are going to be doing a lot more than, the known places where people get vaccines. We're also going to be partnering with schools, drive-through sites, and large volume sites. Like I think many of you have seen or have been involved in community vaccine events, which are very trying to break down those barriers for people, when it's scheduling and time, and it's just it will help us to give the vaccine to being available to communities where it's hard to take time off, especially from work. So that means weekend and evenings. Next, Jorge. And here's just a graph, I know there's all these acronyms in the right side, but it's just telling us the timeline on where the vaccines are being distributed for. Again, these are the pediatric vaccine, which is 5 to 11, and many of them will go to pharmacies and also go to healthcare services. But again, as I mentioned, some of these will also be distributed different community events. Go ahead. Okay. Next. And also something that we want to mention, and I think many of you will probably agree, there is might be some concerns and questions. So research tells us that about 1/3 of the parents will likely vaccinate their children, and right away, like as soon as it's available. And then we have these 1/3 of parents who will wait and see. Basically, I want to ask more questions, and I think you have the right. Parents should talk to their providers, to their pediatrics, to find out, depending, the diagnosis of the child. Like, as many of you who got your vaccine, if there is any allergies or anything that might be a concern, you definitely should be talking to your provider. But again, it's something that we need to start talking a lot more. Has been a process to approve this vaccine, so now it should be available soon. And you can go to our website safe and strong, and it's where we will be using most of our communication, and OHA as well. You can go to the main page and we'll be sharing that. Okay, and so now let's in regards to the vaccine, like a few days ago, I don't know if there's a question. I heard somebody, but I wanted to share also with you, this is a monoclonal antibody therapies. I don't know if many of you have heard, this is probably news to you, or you probably heard on TV or on radio, but it's a therapy that is currently used and approved and is used in Oregon and many states and the US. It's technically as a therapy, as a injection to save lives and to reduce people that when they get infected from COVID to go to the hospital, or basically to reduce the chances of getting really, really sick. So the therapy is used for two different groups. One of them is if people have the infection and they have been having symptoms for the last a few days, like 10 days. And then the second group is for people who have a positive test and having exposed basically and don't show up symptoms, they can also get a monoclonal antibody therapy. And yeah, so who is eligible for this therapy is adults and children older than 12, and this is they have to be 80 pounds or more, and like I said, they have to have a confirmed case of COVID and moderate to severe symptoms. And what else, we're looking at who's eligible, 65 and older, people who have diabetes, overweight, chronic disease, pregnant. So anyone who might be in a immunocompromise, that will help, to alleviate and to basically not end up in the hospital. So, Jorge? And here's just like a picture of and where the injection will go. This is actually an improvement, because before it used to be only apply in the emergency room or in the hospital, where you have to get this injection or this therapy with IV, and now is in a mode of injection. You go next, Jorge. Okay, so what is the cost? So this it should be free and to anyone, and this is regardless of their insurance, immigration status, and most of the, like I said, the Oregon Health Plan, OCAWN, which is the emergency for non-citizens, should be available and qualify. So you can again call any of the pharmacies, health departments, or your primary care doctor, and they should be able to help get this therapy, which again help with any symptoms, or make sure that the COVID symptoms or virus don't get worse on anyone. And okay, and I think there is a slide missing, Jorge. I think that's what I was referring. Sorry, I just wanted to mention one more thing about this therapy too, is that it's 81%. It's 81% effective. So that means if somebody is sick, it will protect you 81% so your symptoms not get worse. And I also want to mention something really, really important. This therapy is not to replace the vaccine. Everyone should be getting their vaccine. This is for somebody, for example, who got their first dose and haven't gotten a chance to get their second one. And, in the meantime, they got infected. Then, this therapy can be used. But like I said, it's something that can give us hope, and making sure that patients don't end up in the hospital with severe case of COVID. And some additional resources. So as of so next week, actually November 10th, we will have a webinar, a collaborative webinar, where we're going to be talking to Dr. Emilio Deves, our senior health advisor here at OHA. The meeting is going to be from 11 to 12:30. It's going to be completely in Spanish. And this is for community organizations who would like to have discussion, provide ideas, have questions, concerns about the pediatric vaccine, and just help us if you have a specific ideas for messaging, or to making sure that parents have the information about the pediatric vaccine, and whether like for their kids or their children to get vaccinated. So we encourage many of you to please join this webinar. Again, it's going to be an opportunity to ask Dr. Emilio Deves any of questions about it. So please, if you can share it with the other organizations or other community partners who might be interested. And I think Jorge is going to copy it and put it on the chat. So if people want to register and join. Next, Jorge. And we're also going to have a Facebook Live, and that's going to be on November 18. That's going to be in partnership with PECUN. And it's again, our Dr. Emilio and Dr. Ruth Zuniga will be talking about the pediatric vaccine. And this is going to be opened again to the public on OHA in Espanol, and it's going to be a live presentation. And additional resources I mentioned, we're hoping to do more outreach clinics and the different communities in Oregon, especially rural communities and migrant seasonal farm workers. And this is again, totally free. Please let us know. Jorge and myself are available if you have any ideas or would like to partner with us to host a vaccine event. You can please let us know, and we can support with any of the logistics, amount of vaccines, what type of vaccine, and we definitely will help to help with that. So again, we actually are available, been doing that in school, farms, housing, markets, grocery stores. We're just open anywhere where we can be accessible to our community organizations. And again, we have our emails and this presentation where you can connect with us. Okay, so just I wanted to let you know about this also, an additional information in the regulation that will be effective November 8th. So in the next few days, non-immigrant or non-citizens that will be traveling to the US will need to be fully vaccinated, need to provide a proof before they board on the plane. And this is an exception for kids or teens under 18 if they have medically unable to vaccinate for emergency, for any particular reasons. So it's very, very important. Also, permanent residents and US citizens who are fully vaccinated need to provide that proof and a negative test in the last 3 days prior to boarding. So you can also read more and find out more details and information on the link provided below. Okay, so I also wanted to, this is an additional resource about Empleo. I'm not sure if you are familiar with it or this is new to you, but Empleo is a non-governmental organization who basically provide information of workplace rights and responsibilities within the US as an employee. And this program has been around since 2004 and is partnering with the local and federal agencies in the Central America and also the Mexican consulate. And this is a completely toll-free hotline where people can call and just if there is any workplace rights that happens at our work that immigrants want to find out and to learn more about. So here's the phone number where they can connect. And I believe, yes, that's kind of where we have. It was very, very straightforward, but mainly we wanted to share with you about vaccine and questions that you may have. I know many of you work with families who, for us, Jorge and myself are pretty we're very interested in partnering with you because we have resources, we have information that we can provide to you, and that's kind of how we're gonna continue helping and supporting our communities. So let us know if you have any questions, if you have any ideas, and not sure if Jorge, if you have anything additional for the group that would like to share.
No, I don't think so. Just, well, yeah, actually I do. I think, the information that we shared about our community partners, if you're not currently working with them, we did provide a list of the contact information for those organizations, and they can help you navigate COVID-19 resources, vaccines, and other resources that are available to families and to yourself as MEP staff. You can reach out to those organizations, and we've provided a document to Luis, and I believe it'll be shared out to everybody. We're also going to share the slides, so they'll have live links on there, and you'll be able to, for example, go in and register for that webinar that Monica was talking about. There will be live links on the slides that you can access. So we'll make all those materials available to you all. And I mean, I don't have anything else other than just thank you. And if you have any questions, go ahead and just throw them our way now.
I'll get started. As you're listening to farm workers around the state, what are some of the major reasons they're not getting vaccinated? Or there's 1,000 different reasons?
Monica, do you want to take that one?
Well, it's many reasons, and I think the ones what we've been hearing is I want to wait and see what happens then. And I think as we set up a peak of people getting vaccinated, I think right in August, that's when Delta started. As you also saw, there is a curve, right, where cases were higher, hospitalizations were higher, and so we saw definitely a more interest on people getting vaccinated. I think the challenge that we face, Jorge and myself and many of our community organizations, is that complexity of how explaining the vaccine, how it was, why was it developed so fast, who created it. And also, our previous administration made it challenging with the mixed messaging that was going on. So there was a lot of uncertainty and not trust with government. So definitely has made it a lot easier, but we're not out there yet. There's still, as you saw, there's a lot of people who haven't decided to get vaccinated. Unfortunately, if people don't get vaccinated, it's hard to tell when are we gonna be done with this virus. I think many of us have adjusted our work or as much as we can, but I mean, does anybody know? We don't, and unfortunately a virus is a virus, and we can control it when we all decide to do the best. Right now, the therapy, I feel the vaccine and the therapy, whatever else is available to help, it's gonna be out there. But at the end of the day, I think many of us, many of people in this group will agree, it's a behavioral decision, and I think that's the most challenging one. With as any other, disease, like let's say somebody who has diabetes, this is how you should be eating. This is how at the end of the day, it's our decision, and I think that's what makes it really hard. We're trying to do as much as we can in OHA with, testimonies, like do this flyer, let's do these interviews. What else can we do? I think that's a huge question. I don't know, Jorge, what are your thoughts? But it's a mix of some people actually. Let me just say one more thing. When we were asking migrant and seasonal farm workers in Umatilla County, we did actually a survey of about 500 people, and most of them, 50% of them, we surveyed, like it was 50-50 people who were vaccinated and people who were not. And the ones who were not vaccinated, they told us, I will not get vaccinated until it's required. The minute the government says it's required, I will get it. So, those are the challenges, and it's hard because then you find this other group that says, why would the government tell me what to do? So it's kind of those controversies, unfortunately. I don't know if I'm making it complicated, but I'm just gonna be really honest in what we've been hearing.
I also saw you with kids. A third of them would get vaccinated. A third would wait and see.
Exactly.
What did the other third say?
Jorge, do you remember that part? I think that's kind of where.
Maybe that's where the different responses were included. Maybe they just didn't know or were uncertain, Jonathan. I can figure that out and send it over to you. But yeah, okay. Let me follow up and we'll get back in touch.
Mm-hmm.
Thank you.
But I was also going to share too that, what we've been hearing from the community partners is that work plays a very large factor in whether people have the time to go get vaccinated. A lot of the times they feel they can't leave work, or they might lose wages or stuff like that. So it's a variety of reasons, I think, Jonathan, that they're not getting vaccinated, but that was certainly a big one. And then they don't have the information. There's a lot of information out there, but it's just simply not getting to the families. And that's what we need help with. We need help with delivering that information. So we try to educate our community partners, the organizations that we work with, and then they can deliver that information out to people. So those are two of the big factors that I've been hearing.
So if you could please help us, whenever we have information in OHA in Espanol, if you don't mind sharing it on your pages so families also know about them, because we put a lot of effort into creating, getting communication out there, because one of the things we learned from talking to people more in Umatilla County was we don't get the information, we don't hear it, it doesn't come from a doctor, so it doesn't get to these families, unfortunately. So our community partners are out, and communicating, but we're talking about small percentage versus having a whole army of people, sharing and letting people know that resources and information are available. And if there's questions that people have, please send it our way. We have professionals and epidemiologists and health advisors who are doctors who can respond to these questions.
Any other questions? Feel free to unmute yourself and ask it. Well, I think in lieu of no other questions, I think you guys did a fantastic job of sharing information, and it's information that we can go share with parents and with other migrant staff. I'd like everybody to give them a round of applause silently, like we do in now with COVID, everybody claps like this. And so thank you for your time and for taking the time to together and share such valuable information as we work together with our farm workers.
Yeah, Monica and Jorge, just if you have any information that or events that you're doing, just send it my way, and also I can put in my newsletter so it goes out to everybody.
Perfect.
And share with them.
Yeah, thank you, Luis, and thank you, Jonathan. And good to see you all virtually, and have a great rest of your day.
Thanks, everyone. Take care. Thanks a lot, Jonathan. Luis.
So to the rest of you, we have a 10-minute break. So from 2:20 to 2:30. So and our next event starts at 2:30. So I'll see you at 2:30.
And it would be Francisco Garcia and the Migrant Award.